So I think that would be fair to do that.
Okay, hello everyone who's here and welcome to a little informational session about ARCH's Innovative and Exemplary Practice Initiative. My name is Susan Summers. I'm a consultant for ARCH, and this is my colleague Cassandra Furman. We're longtime colleagues in respite, very long-time colleagues in respite, and we both work on this initiative and just want to share a little bit of information with you about that. Cassandra, if you want to do the slides, we'll just kind of get started.
I'm happy
on content. So what we'd like to do today is give you a little history about the initiative, why we think it's important, and then we're going to just do the nuts and bolts of applying, what the process is like, and as importantly, what the criteria are that we use to recognize programs that are innovative and exemplary. Many of you may be part of the ARCH network, but for those of you who aren't, every once in a while we come across a program that doesn't really know about ARCH, and we want you to know about ARCH. So if you just go back, Cassandra, this one slide. There you
I'm
go.
sorry.
So the ARCH National Respite Network is comprised of a number of different things. One of the important things ARCH does is have a national respite locator. So both caregivers and professionals can go online and find services, respite services in their communities. You'll see the word short break. That's we're part also of an international community, and they use the word short break rather than respite. But when we say short break, we're talking about respite. And then there's the National Respite Coalition. If you're not a member, we invite you to be a member. This is a really active network that works together to advocate, promote respite policy programs at national, state, and local levels. And then the organization or the work that Cassandra and I do for Jill Kagan is through the Lifespan Technical Assistance and Resource Center, and it's funded by ACL and the Department of Health and Human Services. And our mission is to assist and promote the development of quality respite and crisis care programs in the United States to help families locate respite and crisis care services in their communities, and to serve as a strong voice for respite in all forms. And the Innovative and Exemplary Practice Initiative is a really good example of serving as a strong voice, and we're hoping some or all of you will be part of that voice through this process. Next slide, please, Cassandra. Okay, so.
Cassandra, I hate to interrupt, but we're not seeing the slides.
Oh.
At least I'm not. Are other people seeing the slides? Oh, I'm sorry. Yes, they're there. My fault.
Okay. Okay, good. You know me, I'm not good at solving technology.
Thank you.
So I'm glad they're on there.
I'm usually the one who messes up, but great. Yay.
Okay, good. And we heard from Lisa's stories. They can see too.
Okay.
Okay, thanks, Lisa. Okay, so let me give you a little history about this, about the Innovative and Exemplary Practice Initiative. So it was conceptualized around 2017, and then we did a kind of blanket research of like initiatives in 2017 and 2018, or other organizations that sought to recognize best practices, and often evidence-based practices, which are few and far between in respite. But so we researched the like initiatives, and then we did an initial application process in 2019, and we're going to show you the recipients in a minute. And so we asked programs to apply. We interview them, and then if they meet criteria, they're recognized. Once a program is recognized, they don't need to reapply every year. We do a 3-year review to make sure that they still are meeting those criteria. And the reason we instituted this initiative is that we wanted to identify and document promising respite practices across settings and service populations. So there's not a big research base for respite like there is in other important service fields. And we work often at the state level, at state organizing levels and advocacy levels. And we wanted to get closer to know what's being done, how respite's being actualized in programs and communities. So it's an identification and documentation process. The other thing we want to do, and I just alluded to that, is to learn more in depth about what you're doing. We know that there, as I said, there's not much research available, but we know that programs often base their models on other evidence-based or promising practices outside of respite. So we want to know what programs they're doing. And then we want to know how they're documenting their practice to show the benefits to caregivers, care receivers, and families. I would actually add another beneficiary to respite, but I'm going to talk about that later. So put a pin in that one. We want to learn ways of addressing challenging aspects of providing respite to special populations. And last but not least, we want to honor the work that you all do. The importance to me, I've really been thinking a lot about this is that right now, I think all of this is important at all times, but long-term care is in disarray right now, partly because of the pandemic. And to me, doing respite and doing respite right are more important than at any other time. So just in advance, thanks for what you do in terms of delivering respite. Okay, next slide, please. So we want to, through this process of getting to know you, getting to know your programs in depth, and examining the criteria and seeing how you meet those, we want to create a knowledge framework for respite that doesn't exist in the way that we'd like it to exist right now. So we've developed these 7 criteria from the literature, and initially from the literature, from that review that I spoke about. But we also, and the second point is, we learn from you what those criteria should be, and we operationalize those criteria. So in other words, it's not just that you do this, it's how you do it. A lot of that is learned from you, from programs. So we're looking at program documentation from your programs, performance and evaluation data, how you work to support families, what questions you have about the merit of your work. And, you know, this sounds like can sound a little dry and intimidating when I talk about it, but when we actually connect with you in your program, it's so friendly, inspiring, and uplifting. So try not to be intimidated by the process, because we want to really create this framework. We're going to ask these questions, but we're the opposite of adversarial. We want to support programs in becoming better. Go ahead, Cass. Thanks. Okay, so today what we're going to do is just describe the 7 qualities and characteristics of programs and services that make them exemplary or innovative. So we just want to demystify for you what we mean by that. And then we're going to provide real life examples and strategies that the programs use in all sizes, locations, and funding levels to create innovative and exemplary services. So we want to just make this less abstract. We want you to really recognize what it means to be innovative and exemplary. And we want to look at programs that are different phases of development. And Cassandra, you can jump in here with me. The program on the left is ChildServe, which has had this long, rich history. And who's on the right? Is that Agape?
That is actually Agape, and it now has, this was many years ago when they first started, and they now have an enormous, amazing facility. However, there are programs who are still operating in church basements, in rented houses, home visiting, home providing respite out of small offices. And what Susan and I wanted to convey is that you don't have to be a mega, enormous program. You can be a small program, like I said, operating out of a church basement or a rented home, or a small office when you and caregivers or care providers go into homes and still meet criteria. So we want to make sure people know that this isn't something that requires an enormous budget.
Right.
You can do it well without that.
And connected to that, these well-established programs weren't well-established in year one. They grew sustainably over time. That's one of the things we look at. So early, you have to have been in operation at least 3 years. That's just to fill out the application. So we want to know you're there, and then you're going to stay. But you could be early phase. You know, it doesn't have to be like a big building and big budget and lots of services. It can be small and of high quality and still sustainable. Okay, let's take a look at the programs that we've recognized. This is the 2019 Innovative and Exemplary, and you see a link there to the ARCH website. You can read more about each of those programs. They also often have really wonderful websites, and it might be worth your time to just Google a few and see what's on their websites to see what it looks like. Some of the things they do that are innovative and exemplary give you just a deeper look. And next slide. This is 2020. Now the first year you notice that we just had innovative and exemplary and we didn't break out innovative. This is a good example of what we learned from programs that helped us figure out when we did the operational definition of the criteria. We realized that some were really strong on every one of those 7 criteria. Some programs had everyone met minimal criteria, but didn't quite meet strong standards for like evaluation, for example. So, and when we look at the criteria more closely, you'll see what I mean. That sounds kind of like mumbo jumbo right now, but you'll see what we mean. We'll show you more clearly. And then in 2021, the innovative and exemplary practices. And then in all of the years, we came across some programs that were so inspiring and had so many of the criteria, but not all the criteria. And the ones that we award innovative and exemplary to have to meet all the criteria. These were just missing a little bit. And we're hoping that some of them will come back to us having met the criteria so that we can recognize them. But there was so much to learn from these programs. I can see one in there that I think probably does meet that criteria now. And I hope they're maybe on the call and they'll apply again. But so
actually, we got some news this morning about a program that had applied many years ago, and they didn't make the cut, and they were incredible. And this is before we decided to have the Rising Star category. And we learned that they're reapplying because since they met with us and they realized that they might have been able to do a little more work in 1 or 2 of the areas, they strengthened their programs that way. So they'll hopefully, they said they're going to be reapplying, and we hope so.
Okay. And next slide. So this is the application. Cassandra's going to just walk you through this.
Okay, I'm making the assumption that all my links are going to work. However, if they don't, but they will, you go to the ARCH website, and I want you to go to, it's assuming that you can still see it. Is the ARCH website showing up for everyone? Susan, the ARCH website?
Just the slide.
Just the slide. Okay. Well,
can you see this website on your computer?
I can. So I think what I have to do is stop share and then reshare that the website right here. Wait, right there. Okay.
There we go.
Now I'm hoping you can see the website. Great. So you'll find that there's a lot of information that we have just covered, and then you go down to the selection process. But one of the first thing we ask for are whether or not you have 3 qualifications. And those qualifications, I'm trying to find that checklist. I had it. Preview the questions, 3 questions. And those are that you, checklist.
Yeah, there you go.
Right. So you need to be in operation for at least 3 years. And then do you have written guidelines? And we'll explain why it's important for these written guidelines in a moment. But we want some kind of operational manual, some kind of checklist, something that is used to ensure that your services are provided with fidelity to a model. And we also want programs to be able to replicate if they would like. The third criteria, so before you even apply, have you been in operation 3 years? Do you have some written guidelines? And then do you have a plan for how you're going to measure your performance? That could include a logic model. It doesn't have to be a logic model. It can be a business plan that spells out a goal or more, more goals or objectives you're planning to meet and how you're going to evaluate them. So that is before you do anything, go to that checklist. The checklist is also on the slides that will be shared after this meeting. Then once you've decided, hey, we qualify, we then have an online application. So you'll see in the online application that is also linked to in our website. Basically, I'm not going to go through every item, but you can see we need basic contact information. We want to know if you qualified with that checklist. And then we ask you to describe the program. You'll see we also ask, so we ask questions about whom do you serve, how often do you provide respite, and then we will go into narrative. So you can talk about, for example, how your services are funded, what your evidence base is behind your services, and all the things that we're going to talk about in the next few slides as we go through the criteria. So and by the way, the last slide on this deck has our contact information, and we want you to feel very comfortable phoning Susan. Your name's on the list, or you could also phone me. I'm certain Jill is willing to field your calls, but we're happy to help you if you have any questions about that application process. So I'm going to go back and share my screen again, and I'm going to go back to the PowerPoint.
And just a word about that application, you can save it now and go back. We didn't used to have that option, so that can really help you. And the programs seem to find it helpful to write a response, maybe in Word or something, to some of the questions that require more text. And you can, write those on another document and then cut and paste them into that document.
Yeah, and we will also ask you to, for example, if you have a manual, we're going to say, please, can you provide a link to that so that we can review the manual?
Or upload it.
Or upload it to our computers. What we've found is every now and then people forget that we're not going to disqualify you. We'll phone you or send you an email and say, hey, you forgot to make that attachment. We're going to make this as easy for you as we can. And we want to know more about your programs. Okay. So we're a friendly crowd.
We're a friendly crowd. And let me just say something too about the program manuals and program documents. It is our expectation that innovative and exemplary programs share information and support with other programs. Some do this really freely. Some programs are so well established and so sophisticated, they say, we don't want to just hand this over because it requires some support to use, and we will offer that support. But our expectation when you apply is that you want to be part of this network of mutual learning and mutual support, and so that you will willingly share documents with us.
Thanks. So here are the 7 criteria for selection. I'm not going to read through each of them, but you have them on the slide, because in the next 7 slides, Susan and I are going to expand on each of the criteria.
And let me just say something. These are not asked exactly in this form on the application, but they're all embedded in the form. So that application gets at all of these things. Some are explicitly asked.
Here you'll see the checklist that we follow. So when we receive these, when Susan and I review the application, we have a checklist to make sure that, you know, we can tick every box about your program. And we'd be happy to share that checklist with anyone. It's also on the slide deck, so you'll be able to see them there. Okay, the first criterion, an evidence-based or evidence-informed approach. And I want to really emphasize the evidence-informed idea, because we have a narrow, small group of programs that can really say we fit the classic definition of evidence-based. And generally, the way it's used in our field usually means that there have been 2 randomized controlled trials of the program that has been replicated in different places. And there are reasons that that is a very difficult criteria to reach for respite programs. So we put in and include evidence-informed. That means that people, as they were determining what services they were going to provide, they were looking at the research literature. They were finding what seems to work with most population. They might have looked at the medical literature, the social work literature. They have looked and talked to their caregivers, finding out what they want. They might have done needs assessments. They could have been providing services, and over the years, they began tracking, we hope, to see what worked, what didn't work. In other words, they're using some evidence to determine what services to provide. So it doesn't necessarily need to be the classic evidence-based program, but it needs to be informed by evidence, and that evidence can be research. It can be observations that have been carefully tracked. So they're not just random anecdotes, but they are truly, you're collecting information from caregivers, from organizations, and that your program then changes or is strengthened by the evidence based on what you learn. Susan, do you want to add anything to that before I go on?
No, I think that's good. Thanks, Cass.
The next thing that we look for, and I've got an example here. One of our exemplary programs, Providence House, that is primarily a crisis nursery, but also provides emergency respite. They were awarded Innovative and Exemplary in 2019. And I just went to their website looking around because I know that they are so careful about collecting data, but they have a written plan for how they're going to collect data. And you can see they've mentioned the results here. And then of course you can click on a link and learn more about their research. And they have been partnering with a university, I think 2 universities now, but they also talk about how their, sorry about that. They talk about how their outcomes and their research are all connected to goals that they established at the beginning of their program. So they have identified goals, they talk about goals and objectives, and they talk about how they're evaluating them. So a written plan. Now, we are sharing with you a very sophisticated exemplary example of this. It doesn't have to be enormous. If you think about those buildings we showed you with the program that had been around for years and was in this enormous, beautiful building, and the program that was just starting out, they were still both doing excellent work. You may have a small number of goals that you're working towards. You may have, objectives that do not fill volumes. You don't have to have lofty evaluation plans, but we want to make sure that you have identified what it is you're trying to achieve and that you have some idea about how you can measure those. And go back to the service manual. What's really important to us, and Susan mentioned this earlier, is that other programs can learn from you. That's one reason we want to do this, that you will have something that you could share. So if someone reads about you on the Arch website or comes to you, however, that they will be able to see, oh, this is how they hire staff. Oh, this is what the training and coaching is later on. These are the core components of this respite program. So if I were going to provide a similar program, I have some guidance here. So that's one reason we really want these programs to build the whole learning community that we have. And the second reason is that when we get good outcomes in a program, we want to be able to go back and say what services resulted in those great outcomes. And I'll never forget being at a conference and hearing a presenter, and it was a respite program actually, many years ago, and they were sharing their outcomes, and the outcomes were quite remarkable. And I asked, this is many years ago, so I've been around probably 20 years ago. I asked, what were the services that led to that? You know, do you have a manual? Could someone go back and try and replicate what you were doing? And the director of the program said, I don't really have a manual. I've got it all in here. And that's great for her program, I suppose, but what if she joined the circus? And the next person coming in, how are they going to continue those really good works? So we believe that we need to know how you achieved outcomes. What were the services? Not only to be able to share with others just how you did it, but we want to attribute the outcomes with something concrete. So that's why we think it's so important. And again, the manual doesn't need to be a beautifully published book. It needs to be a collection of the information that one would need if they were going to go into a program and start, hiring staff, determining how to recruit caregivers, so they just need some guidance. I'm going to the next slide, Susan.
Okay, let's talk a little bit about person and family centered services. So those of you who've been around for a while may know that this concept started in the medical community and nursing, and it referred to families having a choice and participating in their care. Now, for respite, we're actually learning a lot from all of you about what it means to be person and family centered services. And here's some of the things that we think about when we're looking and interviewing programs. Family participation for sure. Also relevant choices that match family needs. And that requires that there's some sort of process of open inquiry with families to find out their needs, their preferences, family characteristics, lifestyle. A good example was, let me just, before I give you an example. So after that open inquiry, then there's skilled guidance and support in selecting and using how to use your time, for example, is really important in respite for better outcomes for caregivers. So I wanted to just call your attention to life course tools, because life course tools, you can Google them if you don't know about them. They're a great example of that process of open inquiry and then skilled guidance and support. So participation, choices, open inquiry, guidance and support. The other thing that's come up that we see in really good programs is knowledge of community, so an assessment of needs and gaps. And I was thinking about one of my favorite programs was from year one. It was Masterpiece Ministry, and it was a program that offered respite 4 times a year as part of a church in the Midwest. And one of the things they did was make everyone welcome. And even in some of the best respite programs, they will often exclude kids with behavior problems, for example. And so in this is for children with disabilities. The head of the program told me she frequently got calls from parents saying, well, could my child be accepted because the behavior is so bad? And so the first thing was like, she was open. Everybody's accepted. we will make it work. If your family can be with your child 24/7, we can meet your child's needs for 4 hours or 4 to 6 hours, once every 3 months. And so that changed things for families. The parents helped to train the volunteers. They had plentiful volunteers. So if a child was difficult, it might be 2 or 3 volunteers with a child. So the volunteers could support each other. And one of the things that was so wonderful about this program is that the program knew what the community needed, and the community really changed because of the program. So churches from all over the area started calling because they wanted to replicate. This is a very low cost in dollars and low intensity program that just did everything right. They had their manual and protocol, they did measures, they did supportive training, all in order to make this person and family centered. So again, you can be early phase program, doesn't have to be huge, but this is really key for us. And you may be doing it in some way that we've never even thought about before. That's great. Just tell us how you think about person and family centered services and what you're doing to support them. Okay, next slide, please. Okay, professional development. This is really linked to person and family centered services, because we talked about the open inquiry with families and the skilled guidance and support. That means somebody on your staff, hopefully everybody on your staff, knows how to talk with families, knows how to do a supportive interview, and knows how to offer support to families, choices and support to help them over time. So in order to do that, your volunteers and staff need to be trained so they feel competent, they feel confident with families, with peers, with the organization, and with the community. So it's not just doing this initial training, it's really thinking about how to support volunteers and staff as they go. Let me see if there's something else I wanted to say that. So I'm starting to think more and more about making that experience for staff and volunteers as positive as it is for families. So we talked about benefits accruing initially, I think on one of the first slides, to caregivers, that's a must for respite, but also the care recipients and the families. And more and more, I'm thinking we need to add the fourth thing, and that's volunteers and staff. And, we have a couple programs that have had staff with them for 19, 20 years, or not staff, but volunteers. But turnover and attrition are high, even in really great programs. So if you've done something that you think is really effective in recruiting, training, supporting staff and volunteers, we'd love to learn about that from you. Program and evaluation and data collection. So this goes back to the slides that Cassandra was talking about, having clear, observable, measurable goals. And then the program evaluation data collection helps you determine not only if you're meeting those goals after the fact, but whether or not you're on target to meet those goals. So we want to know if you're implementing the program with fidelity. If you have some way of figuring out this isn't working like we thought, how to change that up. We are interested in consumer satisfaction. We're interested in person family centered outcomes related to the individual and program goals. So this can look like a lot of different things. Again, caregiver satisfaction, important. So is staff satisfaction. Do they feel confident? Do they feel competent? Or do they feel connected with one another and supported? Do you do day-to-day tracking and record keeping? Some people just have this great note system on their computer. So every time a family reaches out to them spontaneously, they just kind of keep track of that. And when they have their staff or volunteer meetings, that kind of debrief what they can do better, and they follow up with families. I remember clearly a program doing that was very effective for them. Do you keep track of the cost of your program and adherence to your budget, and then just overall adherence to your logic model. And those programs that we really see growing and strengthening often have business or sustainability plans. And that means monitoring how you're doing with that too. This little, if you go back to, this was Care Bricks program did this, and or Child Serve program, sorry. I loved this. So they had lots of measurements, lots of goals, and an annual report that's impressive. You can go on their website and see that. But they just asked the kids how it was going during their weekend away. And I thought this was so cute, and they actually get nice data from it.
Yeah, and they have other data collection systems.
Yeah, they're very sophisticated.
Surveys and so forth. But this is really nice, looking at, are the kids enjoying this? Are we choosing the right activities for the kids?
Yeah, it's not the most powerful tool, but we loved it anyways. Okay, so sustainability, we're talking about stable and shared leadership, diversified resources, and a written plan. And one of the things that's so remarkable when you interview programs, they start often with this one powerhouse, often a woman, and often kind of charismatic leader. And that's a great start. But the ones that keep going, those leaders are really smart in that they share leadership, they mentor, they start to pay attention to development. So they organize a good board or a good coalition. So it's not just this one person, the story Cassandra told earlier about, I have it all in my head. Well, you know, when your head's no longer there for whatever reason, all the people that were counting on that knowledge are left not knowing what to do. So that's why the written record, that's why the shared leadership. And also the sustainability plan allows you, if you're collecting data on sustainability, it gives you information about making informed decisions about growth. Growth that doesn't match, or money that doesn't match what your goals are, can really take your program off track. So we look for things like that. People that have diversified funding, nest eggs, or backup. So that's sustainability, and that's kind of where we are. So we just want to hear from you. What do you want? What else do you want to know? What reassurances do you want from us? How can we help you? And just unmute yourself and jump in.
You can also put messages in the chat box. We'd love to hear from you, though.
Hi, this is Sabre Townsend.
Hi.
How are you?
Good.
You've mentioned several times about respite programs, and are they only for children? I guess is my general question. Okay, because you said kids a number of times, and I wondered, because we have a program that it's not myself, there's a number of organizations that are a part of it, but the program that I'm thinking of actually focuses on that transition to adulthood age, like 16 to mid, even late 20s. And so I just wanted to make sure that you weren't only talking about the littles. Although as a parent of a young man, when he was little, I also needed respite, but it's a different type of respite when they're transition to adulthood.
Sabre, you've really helped us, because now the next time we do a presentation like this, we will make sure we include programs throughout the lifespan as examples. Many, in fact, I would say the majority of our innovative and exemplary programs actually serve adults, frail elderly, and young adults too.
Okay.
So yes, I don't know how we let that slide, but yes, we are lifespan respite, cradle to grave. Thanks.
Thank you.
Thank you.
I think she's muted, Susan. It looks like you're talking.
Oh, Susan, you're muted if you're talking.
Oh, sorry, I didn't even know I did that. I was going to say, I've been a early childhood special educator for decades, so I don't even know that don't even realize I'm doing that. But we have wonderful programs, including programs for Alzheimer's, memories care, that transition program that you're talking about. That transitional age is so important for families. So I love the idea of that.
I'd love to know more about it, Saber,
Me
so we
too.
hope you're applying so we can learn. Any other questions? And keep in mind, if you don't feel like asking them publicly today, which we're a safe crowd, you're certainly welcome to contact Arch. Susan, she's the lead on this program, but you could also contact me or Jill. So feel free if you don't have any questions right now. You may have some you're just not sharing.
I've got a ton of them. I just didn't want to be the only one
Go
to answer
ahead.
questions.
Keep going.
Sabra, take off.
Well, so one of the things you mentioned was that the organization or the respite needed to be around for 3 years to receive a full review. So I was curious if there was a program that was maybe in their second year, would you do a partial review to see where they could improve by the third year?
We're not doing partial reviews, but I'll tell
Okay.
you, but you can contact me personally and I'll have a conversation with you that I think might be helpful to you if you want to apply in the third year. And yeah, so I'm here for you for that.
Okay. And then and I mentioned, I read rather in the email that they talked about like a small honorarium if the program was chosen. And then I also wondered if there's assistance, because you talked about it being like a potential to recognize as a potential model for replication. Is there support in once you have this designation to replicate it, or what does that mean?
There's not financial support for that. So the small sort of stipends originally helped support transportation and tuition for the national conference. What programs, one benefit of this is that when you're applying for funds, to have been recognized, to have received this recognition can be helpful for you when you're trying to apply for funds from outside funders. Another thing is, so there are different ways that I think it benefits programs. I mean, the benefit, I think, to the network and to other programs is clear, that you can learn from one another. But one of our program recipients last year is in New York State. And now New York State has this big initiative called Exhale, and they're using the criteria to help all their new grantees meet the criteria to be model programs, and then they can apply for recognition. So so you can kind of leverage it in different ways, but we're also nonprofit. So we don't have, we're not like a foundation. I wish we were, but we're not. But you can use this to leverage for money in other ways.
Okay. And I would like to take you up on the offer for a conversation.
Great.
How do I reach you, or is your email in the chat? Or
Yeah, you'll look on the last slide, you'll see, and you're going to get a copy of the slides. So
okay,
just
I'm
reach
going
out
to
to
go
me and
ahead.
I'll spend some time going through the, what we look for.
thank you so
Susan,
much.
With specific respect to your program. Yeah, no, thank
Okay.
you. Thanks for your interest and your work on
Sure.
this.
Thank you.
Let's see.
I'm typing your email address into the chat.
Okay.
Hi, this is Elaine from North Carolina.
Hi, Elaine.
My question, we have a program that's pretty robust, but we've had a lot of staff turnover. So the people who created the program aren't here. We do still have some communications with one of them, but my question is, how much information do you really need, or what is the emphasis on the creation of the program and the logic model, as opposed to how we're measuring it and showing you what we're doing today. Because honestly, I'm not sure. I don't know how they came up with the program. I love that they did, but I don't know how much of the historical information.
We've had other programs like that, Elaine, that were, we always ask for history because we're just really interested, and that helps us learn about how programs establish and grow. But no, you don't have to know the history, but you still need to have documents to run it. You have to know what you're measuring. So those criteria, and I bet it would have been helpful to have a little passing off of knowledge when you took over, huh?
Yes, it would. But you know what? We figured it out.
Yeah, that's great. Yeah, that's wonderful.
Thank you.
And I'm glad you're robust during these crazy times. That says a lot.
One thing we have learned about respite programs, with especially Susan's work with sustainability, that keeping historical records, even if they're just really brief notes, and making sure other people, I'll put it this way, Susan and I are both 70, we're birthday twins, and we need younger people to be aware of what's going on so they can at least carry that memory. Jill has the best memory. She knows everything that there is to know about respite, but we just need to make sure that other people do too.
Now, be nice to whoever comes after you, Elaine. Write it down.
I'm working on that.
Yeah, good.
My board has specifically asked me to create a succession plan. So.
Oh, fantastic.
Work in progress.
Yeah, good for you. Yeah, we'd love to hear that.
There are a couple of questions in the chat if you'd like me to read those off to you.
Yeah, that'd be great.
We have a question for program evaluation and data collection. Is the data acceptable to use from before 2020?
Yes, we love to have data, but we want to know that you're continuing. So you need to be measuring also what you're doing, but longitudinal data is good. It's good to see how your program changes but you should be currently also collecting data.
Now, if you only have the data organized to be able to report on it now, that's good. Send it in, 2019 even. However, we want to know that you're continuing those data collection efforts.
Right.
I would also clarify that the program has to currently be in existence. It
Right.
can't be from a
Yeah.
pilot program that collected data and then stopped. Right?
Yeah,
Absolutely
that's correct.
Okay, there's another question here. How long does it take to become recognized? Will we receive the notice prior to the ARCH conference in September?
Yes, you will. Once we close the application, once that deadline is passed, we review right away. We schedule interviews. The interviews take usually about an hour. And as I said before, you don't have to be afraid. Nothing bad happens. They're really, really fun. You get to brag about your program to us. And it's one of my favorite things that I've ever done in my whole career. Innovative and exemplary interviews, getting to know programs. And we do let the programs know before the ARCH conference in September.
Well, I think we're hoping to let people know by early June at the
Yeah.
latest, because we know it'll take time to make your travel arrangements with us. I don't see any other questions in the chat.
So I'm reading a book about introverts and how painful it is Zoom meetings are for them. I'm actually an introvert. So if you didn't feel like asking a question, please reach out to me, and I'll try and help you figure things out.
Don't let the application be intimidating.
Yeah, I've posted our email addresses and the link in chat. And I'm also going to go ahead right now and share the screen and take you back to this last slide that has our information. So play from current slide. So there's our contact information again. Make
Yeah.
sure you have it.
And so if I hear from you via email and you want to schedule a phone call to talk more in depth, I'm happy to do that.
And the deadline right now is March the 15th.
Okay, are we good to go? Thank you
But
so
I have
much.
a quick question. I'm so
Oh,
sorry.
No, that's fine.
Did that deadline change? Was that initially March 1st, or was that something else that was due tomorrow, or some deadline I have totally confused?
So that was the deadline for submitting a conference proposal. If you want to do a breakout session at the National Lifespan Respite Conference.
Got
It's
it.
a completely different initiative.
Got it. Thank you.
Sabra, I'm just like you. I've got so many things on my calendar and I get messed up.
Well, unfortunately, the timing of them both just happens to be on the same track, and we've been sending out emails at the same time.
Right.
for
I
two
just
different-
saw Arch and thought,
Yeah.
there's no way I can do this between now and tomorrow.
Yeah, no, it's March 15th. That hasn't changed.
Okay, great. Thank you.
Okay, thank you everyone for your interest, and I hope we'll have a conversation more in depth soon.
Thank you.
Thanks.
Thank you, everyone.